I'd like to talk to you about reverse total shoulder arthroplasty, which is a procedure we do for people with arthritis and a loss of rotator cuff function. So the way the shoulder normally works is that there are a group of 4 muscles that come from the shoulder blade and attach on the upper part of the arm bone known as the humerus. Those 4 muscles are called the rotator cuff, and they rotate the arm back and forth, and even more importantly, they start the lifting function of the arm. Now, once you get up to about this level of lift, your outer muscle, the big deltoid muscle on the outside, does most of the rest of the lifting function of your arm, and the rotator cuff turns into what we call a depressor of the humeral head. That means it lowers the ball within the socket as the rest of the arm comes up high. Well, unfortunately for some people, they develop over time a tear of the rotator cuff muscle, especially the supraspinatus. That's the muscle that does the main lifting function. And if that muscle cannot be repaired, or if that muscle has torn, repaired, and retore again, and we really don't have any hope of repairing, then that rotator cuff deficient shoulder has abnormal mechanics to it. It begins to sort of rattle around inside the shoulder, and that begins to do damage to the cartilage coating on the ends of the bone. You subsequently develop arthritis, not osteoarthritis, which is what happens when the cartilage coating deteriorates all by itself, irregardless of what's going on with the muscles. No, this is what we call rotator cuff deficient arthritis, or the term we use for that is rotator cuff tear arthropathy. So for people that have that condition, no rotator cuff tear that's working well for them, it's deficient, and arthritis, that's going to produce a lot of shoulder dysfunction and a lot of pain. It's difficult for them to do anything that requires them to get their elbow out away from their side, and so trying to get their hand up to the top of their head, or even sometimes to brush their teeth or eat, and certainly daily functions can be very, very difficult. So for those patients, they need a joint replacement in their shoulder. But if we give them a standard joint replacement where we replace the worn out ball with a metal ball and the worn out socket with a plastic socket, that's called an anatomic repair. Well, if we do that surgery for those kind of patients, they'll still have all the same problems with their rotator cuff. We need to give them a surgery that can replace the function of the deficient rotator cuff, that muscle that elevates it. Well, this is how we do that. We do that by reversing the shoulder. So in a reverse total shoulder, we put a base plate where the socket used to be, which is a metal plate with 4 to 5 large screws that anchor it to the scapula, the shoulder blade. And then on that base plate, we put a metal ball. On the socket side, we put a stem that goes down the middle of the bone to anchor, and then we place a plastic socket so that these fit together. Now, why have we reversed the ball and the socket on this reverse total shoulder? Well, the reason is this. In a regular total shoulder, an anatomic shoulder, the point at which the arm rotates is right here at the base of the socket where the base plate is. But when we do a reverse total shoulder, the point of rotation is somewhere deep in the socket that's on the bone, on the humerus bone. And that distance, that little distance right there between the 2 centers of rotation makes all the difference in the world.
I'm going to pick that up for you.
All right, thank you.
Let's make a note, and let's start back when you're talking about the reason to do it being different.
Okay.
Like hold it back up kind of where it was before it fell.
Okay. Okay. All right. So why would we do a reverse total shoulder? The reason that it's different is the center of rotation. In a standard shoulder, your native shoulder, or in an anatomic shoulder replacement where we're trying to reconstruct it just like your shoulder, the center of rotation, the place at which the shoulder rotates, is right at the base of the socket or where that base plate is. But in a reverse total shoulder, the center of rotation is over on the humeral side, way over here at the base of the humeral socket. That difference in the rotation makes all the difference in the world. Because when the center of rotation is on the socket side, you got to have a rotator cuff to lift the arm, and if you don't, you'll do this. But when you move the center of rotation outward, it allows this big deltoid muscle to now start the elevation process. And so a patient that's had a reversed total shoulder that couldn't lift their arm before, now they should be able to lift their arm and get it at least high enough to get their hand to the top of their head and do things on their face and do a little bit of light lifting and reaching. In addition, we've given them new surfaces to replace all that worn out bone and cartilage, and so they don't have the same kind of pain they had before. So that's a reverse total shoulder. It's done again for people with a deficient rotator cuff and also significant pain and arthritis. And hopefully when all's said and done, the patient restores their ability to use their arm and is pain-free.